Hi everyone, my name is Mia Zetter, and I'm currently in the family nurse practitioner track here at Eastern Kentucky University. And for my project this semester, I chose the topic of anti-vaccinating parents. As a pediatric hematology oncology nurse, I see patients and their families admitted to our hospital who are impacted by those in our community who choose not to vaccinate their children against preventable infectious disease. More than 1.5 million children under the age of 5 die annually from vaccine preventable diseases. Early childhood vaccines save approximately 3 million lives annually. Yet many children still continue to go unvaccinated or undervaccinated with incomplete vaccine regimens. One goal of Healthy People 2020 is to increase immunization rates and reduce preventable infectious disease. One of the nation's main public health goals is to reduce illness, reduce hospitalizations, and decrease deaths from vaccine preventable disease. My PICO question is this: in parents of unvaccinated preschool age children, how does community health face to face vaccination education, compared to no community health education, increase immunization rates within 1 year? For my supporting literature, the first article chosen was a systematic review that looked at the impact of face to face education and informing parents about early childhood vaccines. This article also assessed the parents' knowledge of vaccines, attitudes towards vaccines, and anxiety related to vaccinating. It was found that face to face education was effective in increasing vaccination status, the length of vaccinations as far as how many vaccines were obtained. Parental knowledge was also increased, but it was determined that little or no change happened when it came to attitudes or anxiety towards vaccinations. The second article chosen was a 3-arm individually randomized control trial that evaluated two different face-to-face education approaches against a control. Arm 1 was framed as gain, and the education was approached as the child is less likely to get tetanus if vaccinated, so that was the gain. Arm 2 was framed as loss, so the education was framed in the aspect that the child was more likely to get tetanus if not vaccinated. And Arm 3 was the control, which the control received absolutely no education. This was a smaller sample size in this trial, with only 722 participants. All participants, though, were between the age of 0 and 36 months. The follow-up interviews were done 7 months post initial education, and the findings were that face-to-face education produced a 43% positive difference in vaccination rate between the control group and the groups that received education. My third and final supporting article was a qualitative review that also looked at parents of unvaccinated children and their willingness to receive vaccination education, and to discuss the importance and benefits of vaccinating and of early childhood vaccines. A total of 20 mothers and 5 couples were included in this review. All were interviewed in either public locations or their private homes. Through these interviews, it was discovered there are 3 primary points when vaccination decisions can be influenced. The first was during parents' initial decision-making process about vaccines. The second one was as parents are continuing to assess vaccination options. And the third and final one was at particular points in time when circumstances were influencing a parent to reconsider previously made vaccination choices. In addition to these three primary points, there was one other common thing voiced by all parents interviewed, and this was that it is important to have a healthcare provider who listened and provided information and education specific to parental concerns. When it comes to applying this research, community-based face-to-face vaccination education can make a direct impact on parental knowledge and increase immunization coverage while at the same time decreasing the spread of preventable infectious disease and unnecessary death from vaccine preventable diseases. Thank you.